Hi everyone, and welcome to AARC's Big Ideas Theater. I'm your host, Ed Heiland, and joining me now is the driving force really for AARC, Executive Director Tom Kallstrom. Thank you so much for coming by and joining us.
My pleasure.
Give us some ideas about, and some thoughts, I guess, about this big birthday we've got coming up, the 70th for AARC.
70th birthday. It'll happen on April 15th of 2017, which is an interesting day because it's the same day that Jackie Robinson broke into the majors. His first day was played that day.
Wow, that's another historical milestone at the same time.
So we're excited about it. We have some things that are already being planned. One of the plans that we'll be seeing is actually in Cleveland on the Case Western campus at a museum, a medical museum called the Dietrich Museum. And they've asked that we be there to have a 2-month display about the profession, about the association, and also showing some of the photos and equipment of years past. So what's great about that is that it's actually where a lot of pediatric respiratory got started, right on that campus. So it's pretty neat.
Close to the Rock and Roll Museum, perhaps?
Not too far away.
That's fantastic.
Yeah.
Well, talk a little bit, if you would, about the moves toward bachelor degree, postgraduate respiratory therapist. What progress, really, have we seen concerning the AARC's initiative? Well,
the ship is turning. We wanted to do this in a stepwise fashion. We didn't want to push too fast, too hard. Interestingly enough, our goal is the same as nursing, that by 2020 we have 80% with the degree, bachelor degree. So what we're going to do is we're going to look at, we're going to do a human resource survey next year. We're going to see where we were compared to the last survey three years ago, and see if we're on track to hit that 80%. But we want 80% with the degree or actively pursuing it by that date. So we're making sure that the 4-year universities and the 2-year universities are working with each other, and so that there are articulation programs that they can fit within their own model of education. We just don't want to proclaim something that we feel is good to do and then just walk away. As I mentioned before, we want to walk the talk.
I was going to kind of follow up a little bit on that and just ask about things that are in progress right now that are going to help make sure that you reach the 80% goal.
Sure. We've put together some places on our website where schools that are interested in learning more about this and learning to get some of the tools can access it now. We are actively reaching out to 2-year programs that fit the mold for being likely ones that could position now, and we are already working with some of them. So again, this is an active program, but again, it's something that we're not pushing on them, but we want them to be realized that this is something that is the future of healthcare. We have to have that 4-year degree. It's important.
Let's jump to Washington when we're talking about the future. Obviously, everyone's talking about healthcare as one of the major issues in the upcoming election, but telemedicine is certainly on AARC's mind. Give us a status update, if you will, on 2948.
So 2948, there's 67 co-sponsors. Now, there's a couple of other bills in Congress, but they don't mention respiratory therapists. So we hang our hat on this one. None of the other bills have anywhere near the number of co-sponsors that we do. That's encouraging, and it's bipartisan, which is even more encouraging.
And unusual, for that matter.
Yes. So, obviously, we're in October. We're approaching a lame duck session. We may or may not see it happen, but we have commitments that if we don't get it in this year, we have some congressmen and senators that are going to help us to drop bills next year. We're going to continue to push this because this is really the future of healthcare, not just in the hospital, but beyond the walls of the hospital as well.
And is this also a time to call for representatives, AARC members to call their representatives?
We encourage members to call their representatives, to email them, to let them know. Many of them are back home on break right now or soon to be, so never hurts to stop that as well. In fact, I'm going to be meeting with my congressman, Dr. Michael Burgess, in just a couple weeks as well.
Fantastic. Yeah. Let's talk a little bit about a big event took place yesterday, the second Patient Advocacy Summit. Both of us were there. Great time hearing from the patients as well as the experts.
We couldn't be more pleased to see the response that we got from that yesterday. We had a large number of patients. Many of them were on oxygen, so we were ready in case we needed to have backup for them. We had respiratory therapists all over the room as well to interact with the patients. We want to find out from them what it is that we as a profession can do to advocate for them. Because at the end of the day, they really don't have an advocate. And what's happening is we see CMS, Medicare, tightening reimbursement for oxygen in the home. It's very, very difficult to get the right oxygen unit in the home now. And we are going to make sure that we fight to turn that around. Our patients cannot suffer anymore. So that's a big fight that you're going to be hearing more about going into next year too.
Something we continue to hear about in very positive ways, the foundation, the AARC Foundation. Give us some ideas. We were both at the big fundraiser last night. Give us some ideas on how the goals are going. It was well attended.
Well attended. We had about 375 last night. We were able to engage a lot of folks that hadn't been there before. We were able to have actually Billy Dawson, who you're going to be interviewing later, to be part of that event. He did a great job. But we raised over $50,000 last night, and that money is going to go back to provide reimbursement for grants and scholarships, and perhaps even other endowments into the future. We're the only foundation that represents the interests of the profession, and we need to make sure that we are there, that we can give back as well as take in.
And it's a chance to actually join a working organization that does give back. I mean, members here and are perhaps watching this video can not only perhaps dig in their pockets, but also can devote some time to help.
That's right, and I would encourage them, if there's an interest, to give, to go online, AARC Foundation. It's AARC, not ARCF, but AARC Foundation, all one word, where they can find out how they can give back as well electronically.
Tom Kallstrom, thank you so much for joining us once again.
All right, my pleasure.
And this is the Big Ideas Theater on AARC-TV.